LGBTQ rights recognition and so on. And we still have a long way to go. So let's just sort of check in and talk about how you see the state of affairs in your regions and in the country. So let's start off with you, Phyllis, over in Greater Cleveland.
And so thank you for having me. It's such a pleasure to be here and to be able to give my thoughts and hang out with these amazing individuals on this panel. For us, we talked a little bit before, this is not our first sort of epidemic, pandemic. This is a pandemic, but certainly the LGBTQ community has been through some things in our history around getting recognized and support that we need. And so when we began to learn of COVID and then realized that it was gonna have the impact, that it could potentially have the impact that we're seeing, I called back to the days of, being activists and acting up and ensuring that all of those in our region who were rallying to give support, to think about strategic direction and a smart and sustainable way to support us through something that was unprecedented, to not forget the LGBTQ community. We are those who would be most vulnerable for some of the negative impacts of coronavirus, of COVID, left out, challenged, housing, jobs, access to healthcare, all of the things. And so really what happened for us, I believe in our region, is that we remembered who we are and began to speak up and take to the streets and say, don't forget us. This is important. We have elders, we have young people, and people in between who are going to need to be thought of as we are preparing ourselves to live with this pandemic.
And demanding to be heard is such an important part. It's not rioting, it's not destruction, it doesn't threaten America. It's as American as anything to stand up and demand to be heard, and then to use the reference points of the past pandemic of HIV/AIDS, and which still affects us all, and ensuring that we counter disinformation. Ellen, how are you confronting these kinds of issues? You have a long history over at Fenway. How are you confronting this in a way that corrects impressions, gets good information out there, helps people navigate?
Thank you. So, and again, thank you for inviting me to join this group. I'm really delighted to be here. So Fenway Health is many things, actually. It's a federally qualified health center. We serve over 33,000 patients every year, well over half of whom identify as LGBTQ. We also have a major research institute which does population health and HIV research. And we do a lot of education and policy work that sort of stems from all of this. And we have a number of public health programs that are designed to meet folks kind of where they are in terms of the whole host of challenges that they're confronting in trying to live the lives that we all deserve to live, basically. So when COVID hit in particular, of course, what we intuited and knew immediately was that it was going to be very important to center the fact that LGBTQ people and people in BIPOC communities are going to be disproportionately impacted anytime there's something like this happening, and that has been the case. Part of the push for Fenway Health, actually, interestingly, has been to try to make sure that data is collected. So we've been doing a lot of advocacy work to make sure that, or to try to get public health departments locally, statewide, and even on a national level at the CDC level to try to capture sexual orientation and gender identity information about people who are testing positive for COVID, so that we can know how it's impacting our communities. So that kind of advocacy work on the background, if I can say it that way, has, I think, very significant implications for our long-term ability to understand what pandemics and other social challenges sort of mean for our communities specifically. At Fenway Health, we had to pivot rapidly, not surprisingly, to provide as much as we could, as quickly as we could via telehealth. That, of course, posed a huge challenge to our organization. We also we have well over 600 employees, had to move nearly 3/4 to remote work situations and try to make sense of all that really quickly. I would just offer that that was actually kind of a remarkable thing to do and experience, because what we learned is that we can do it. And we can make rapid, substantial changes very quickly when we need to, and continue to serve our patients and community. The perhaps unintended benefit of this has been that, you know, telehealth is a very powerful tool, actually, that we now have at our disposal, that we intend to continue to kind of integrate into our regular care and services. Not everybody has access to telehealth services. This is an issue that we will confront in terms of our advocacy and policy kind of efforts as well. But to the degree that folks have that as an option, for example, we're now able to work with patients in 20 states. That wasn't possible before COVID because we didn't have the freedom to operate telehealth programs and get reimbursed for them, which is, you know, part of how we stay in business. So, you know, we're looking at both opportunities and challenges in this context. We are involved, as it turns out, in terms of the past. You know, we're part of the HIV vaccine prevention network and the HIV prevention network and the HIV vaccine network. That was all created in the time of just sort of the 80s and 90s. That is exactly what's being repurposed right now to do COVID vaccine research. So Fenway Health is a part of the vaccine studies that are underway right now. And
one of the things that I think is so fascinating here is that, and Phyllis mentioned it, you're mentioning it as well, Ellen, is that in earlier eras, there was a separation because of fear, because of misunderstandings, because of discriminatory practice. There was a separation between different organizations that are natural partners. And what we're seeing is not a perfect world, but a world in which you can collaborate, and you can take the expertise that was developed, that unique expertise that was developed through the HIV period, or the rights period, and you can share that with others. The development of vaccines is another area. And Imani, you're running an organization that has this sort of national footprint, and you're creating allies, and you're collaborating, and you're movement building. Talk about how you see this era right now from your perspective on a national level.
And I'm sorry, you said, talk about how you see this.
Talk about how you see this moment from a national level in terms of your work as a coordinating and galvanizing entity across different divisions.
Perfect. Yeah, thank you so much. Thank you so much for having me. Ladies, it's always a pleasure to be in the same room as you. So thank you so much. Yeah, my name's Imani Rupert Gordon. I'm the executive director for the National Center for Lesbian Rights. My pronouns are she, her, and hers. And, you know, this has been a very interesting time for us. You know, I think that it's really important to name that we've come a very long way in the LGBTQ movement, and we still have a very long way to go. And I think COVID has really highlighted that. You know, when NCLR was started as a way to be inclusive and a way to be intersectional, because the needs of women and lesbians in particular were not being met by the larger LGBTQ community. And so NCLR was created to fill a gap. And what our work has been doing since then has been to find holes in the community and find ways that we can bring more folks with us. And COVID has really highlighted just how many holes there are, because what we see is that everyone is affected by COVID, but we see that Latinx communities are much more likely to be testing positive, and Black communities are more likely to die from COVID-related illnesses. And so these are things that we have to think about when we look at intersectional issues. You know, it's not enough to just look at LGBTQ communities separately, because for those folks that have multiple marginalized or underrepresented identities, we know that these are that it's more than just that. We have to consider everything here. And we also know, you know, similar to Ellen, some work that we've been doing at NCLR has been some advocacy to get numbers to figure out how COVID is related, how is affecting LGBTQ people. We know that it's disproportionately impacting people of color. We know that anytime there's anything that can negatively affect anyone, that folks of color, that LGBTQ folks, that low-income folks are more likely to be overrepresented negatively here. And so one of the things that we've been doing is some advocacy to start collecting data in our state of California. And that's been something that's really important because there's only a handful of states, we're just starting now. There's only a handful of states that are collecting this data right now. So we can only know how this is going to affect our communities. And I think that's really important because, as it was said before, this is not our first pandemic. And it took us a very long time to start collecting all the needed data so that we could respond to folks that were being diagnosed with HIV and AIDS. And the fact that it took so long and the stigma that was attached to it is one of the ways, the barriers to having us get to zero today. That's even still today. Our lack of leadership, our leadership coming so late to the game to handle these pandemics has something that's been really, really difficult. And that's something that we see repeating. And I think that's really important to name because, like everyone has said, this is not our first pandemic. There are things that we could be doing differently that haven't been done. And so we want to make sure that we are out there advocating for the things that we know matters. And we know the data informs policy and policy informs funding. And when we're not collecting our data, then we will not have the tools to take care of our community now or in the future.
The similarities between that era and now are pretty striking. From where I stand as a white cisgendered male, I'm looking at this and I'm saying, okay, well, back then there was a lot of disinformation. There was a lot of demonization of people who were trying to protect themselves or treating others. There was a lot of talk about how marginalized groups kind of deserved what they got. There was a lack of concerted effort to attack the virus on a research level. And a lack of coordination on a national basis, where you had centers of expertise trying to fight, even within the government, and fighting against their own administration. At that point, it was the Reagan administration. We're seeing a lot of this go on. How are your communities, your organizations responding to that side in a way that helps the people who you're trying to whose interests you're trying to advance? Are you finding a more sophisticated platform, Phyllis, as you're trying to deal with the situation over in Ohio, where it's an election year, so Ohio is going to be the center of a lot of attention, right?
Yeah, we are really focused at the LGBT Community Center in Greater Cleveland on serving the individuals in the best way possible. And so I understand the politics around this. I can't say that I understand it. I see and experience the politics around this and see the parallels that you pointed out, and can say here we are again in a situation where those of us who are most vulnerable are in some ways under attack, right? And I would use that strong language in that even the fact that early on, there was this sort of like, okay, if it's impacting older people, that's fine. You want to sacrifice that older people for your grandchildren. And I was just like, what is this? Like, who are we? Who gets to place value on who gets sacrificed?
People with disabilities.
Yes, people with disabilities, right? And
devaluing an individual because of some judgment that and of course it's never me, right?
The whole line around essential workers, and who they are, and and so we all know, what's going on in terms of that. So it feels huge, right? It feels like business as usual in some ways, and so our response to that has been to listen to individuals who are impacted, and to pivot our services so that we can best serve them. And that is our focus. And so, that meant, our seniors couldn't come to the center Monday, Wednesday, and Friday for their socialization, for their meals, that they enjoyed together, for the exercise, and the yoga, and but we had to figure out what to do. So we pivoted. We got onto these virtual platforms. We learned how to use them very quickly, down and dirty. We listened to our elders. They're like, after the stay-at-home order, they were like, we need to come back. And so we figured out how to make that happen. So while they don't eat together now, they do come to the center in smaller groups, and they get to take their lunch home with them. So we know they're being fed. So there's so much that we've done to really focus on the individuals who are directly impacted in the best way possible as a community center here in Cleveland.
And we just took a poll, and the results of the poll are quite interesting. We asked people to answer twice as to what the most important needs are. And the two most important needs were physical and mental health support, and that includes socialization and all of that, and then support for legal rights. In other words, to support people in that way. There were other answers that could be given. What was interesting is that jobs received no answer, received no support. There were other answers about community connection and family services and so on and so forth. But it is striking that physical and mental health on the one hand, legal rights on the other, seem to have gotten a lot of focus. Jobs were not the big issue right now, given where we are. And I find that to be very interesting. Ellen, when you're talking about adjusting to this time, are you finding that those areas of physical and mental health is the biggest concern that people have? I know that you provide those services, but you also provide other services as well.
Yeah, I guess what I would offer is that we really can't know what not naming jobs means in this context. It may just be that folks are not choosing that as top two relative to the LGBTQ community specifically.
Right.
I'm confident that this is an issue of great concern to many of us in our communities and with our family members and loved ones who are struggling. But I think to that point around it so clearly being physical and mental health, we've certainly experienced that. I mean, what the word that hasn't come up yet in this hour is the word trauma. And, I think it's fair to say that trauma is both, COVID has brought us kind of new trauma, but it's also awoken and exacerbated existing trauma in our communities. There is fatigue and just this, I don't know, my own sense here around, and even working with our team, is that just the fact that we have to now sort of settle in to a fall season and a foreseeable future of having to live in this way is very challenging for people. The experiences people have in their homes every day. There are people who are in harm's way in their homes, right? We have to remember that. And so we get that. Our patients call us and they need support. And then, of course, everything that's happened sort of in the aftermath of George Floyd's murder and before that, of course, but really amplified, I think, by that particular event that happened at the end of March is another triggering event that has brought great trauma onto our community. So people are really, really handling a lot. And that, again, the ability that we have to focus some of our care and services into a sort of a telehealth, sort of an online support network, that has been a really high priority for us. The demand for our behavioral health services has gone through the roof. We are experiencing unprecedented wait times again for that particular service in our organization. The other thing I'll just say, and I'll stop, is we have to remember, and we try to bring this forward whenever we're kind of engaging people. People need their 6-month checkups, they need their screenings, they need their regular health care now. And a lot of that has to happen in person. There's only so much you can do via telehealth. So part of the challenge now is really figuring out how we can try to make our environment as safe as possible so folks can come get the services and care they need, and so that they're hearing from us and really know that they can do so in a way that's going to work for everyone.
One of the things that I find so interesting is that there was earlier on in the pandemic this debate between stopping everything and not stopping anything, right? And now I think we're all coming together, whether it's red state or blue state or conservative or liberal or progressive or whatever, we're all coming together where we say, look, we at least have to navigate this. Now, there might be different opinions, but we do have to continue navigating because we have to keep living, right? Right, Imani? I mean, you have to keep going. You can't stop advocating. You can't stop providing the services that Ellen pointed to, or that Phyllis pointed to. And you as a national organization, Imani, you just can't pack it in, right?
Right. No, we can't at all. You know, one of the things that I think is a misconception is that work stopped for us and it didn't. You know, NCLR is, we do a lot of work to achieve human and civil rights. But a big part of what we do is impact litigation, and the courts didn't close. And so that's a really important thing, that we are still very much doing work. Fortunately, folks are able to work remotely, but the courts are still open, and so that's happening. We also do asylum work during the pandemic. We've seen that people have won their asylum cases, so work is still very, very much happening, which I think is just really important. And I also wanted to echo what Ellen said. I think that it's really when we think about the issues that are affecting LGBTQ people, it's often the same issues that are affecting everyone. And I think an important thing to name is that every issue is an LGBTQ issue. You know, there are things that disproportionately impact LGBTQ folks. You know, LGBTQ young folks are 120% more likely than their straight and cis peers to experience homelessness in their lifetime. Much more likely to experiencing bullying in school. Older adults are more likely to experience discrimination in elder care facilities. So there are ways that we are disproportionately and again negatively impacted, but everything affects folks. And we start thinking about this. It's not an intersectional issue. It's actually an issue of multiple jeopardy. People are facing multiple forms of discrimination at every single turn. And I think that that's something that's really important. So thinking about being able to afford housing, jobs that pay a living wage, these are all things that are important. And again, just to echo, during COVID, this is much more difficult. You know, we're seeing, Phyllis, you had spoken about this, essential workers, not all essential workers are treated or paid essentially. And these same folks are often the people that are experiencing discrimination in other ways and don't have the same economic power and access to resources. So there are a lot of things adding up against the most underrepresented in our community.
I love the points you all are making, the whole idea of trauma, and then the fact of belonging to the LGBTQ community, or being Black, or being a Hispanic person of color, acts as as almost a multiplier. It has a multiplier effect on this. We asked another question, where the discrepancy in terms of rights and equal treatment is most acutely felt. And we asked people to choose two different definitions. And we used different definitions. And the two definitions that seem to have attracted the most attention are rural areas, people in rural areas having the most discrepant experience, and people in the southern parts of the United States having the most difference. Do you, in terms of your own perception of the issues that are felt by the community, how do you feel about those two definitions? People living in rural areas, people living in the South. Are those areas where you think that there is more work that's required, and are you working in that? I'm going to give it to Imani first because of your national profile, Imani.
Sure. So certainly, when we think about state laws, and there are definitely ways. There's definitely rural areas, parts of the South that just aren't as friendly to LGBTQ folks, and we know that that's true. But some of the stuff that we do at NCLR is to have some representation for folks. One of the programs that we have that's happening September 21st through the 27th, you can register on our website. It's called Rural Pride, and this is something that happens every year in a rural part of the country. And the idea here is to provide an access to resources to folks that even pride parades, when they come around, are still hours away from some folks. We have to remember that not everyone sees themselves represented and is able to find support everywhere. And so rural pride is the way it moves into different rural parts of the country. This year, obviously, will be virtual. So this is something that will be accessible, hopefully, to more folks. So, I think people experience discrimination, obviously, all over the country. But when it's not, I know in California, we get a lot of support. We get a lot of support from elected officials. We get a lot of support. There is sometimes a different culture, and we see ourselves represented in different ways. And so just finding ways to see yourself represented and to provide more access to resources is something that I think everyone's looking for.
I'm interested, Phyllis, in your take on this situation. When somebody is racist or against people of a different orientation, or I don't know, hates men, hates women, hates Jews, hates Muslims, or whatever, how do you see that dealing with that? Because are those people aren't necessarily evil, right? I mean, there is evil out there, but it doesn't mean that those people are necessarily evil, right? And there are belief systems that tend toward those attitudes. How do you deal with that?
Certainly. Well, we, part of our mission is around education and advocacy. And so education is really important. And sometimes it gets really tough, to go in and, this whole, changing the hearts and minds of everyone. And it gets really tough to say, like, I'm worthy as a Black lesbian feminist, who grew up in a single family household or whatever. I am worthy of all the rights and respect that anyone else has. I might not have as much privilege, but I'm certainly worthy of the basics and of consideration and folks being worthy of consideration. So we don't do anything without, living into our mission around educating, around advocating, around supporting professionals to be better at their jobs, because we are going to give them information about who we are and how the decisions that they make within their organizations and how they serve impact our lives, directly impact our lives and other people. Like folks have pointed out, we are in all those groups that would be seen as individuals who have been discriminated against or need support. And so my response to that, our response to that and most is that we're constantly educating people about who we are so that those good people with this misinformation about who their friends, neighbors, family members, and coworkers are able to see us. So somebody mentioned pride events, being visible helps, right? Being included around conversations around policy, around everything that happens helps. And so I think, I'm all about it, as a small nonprofit, even when we were smaller, one of the things that we were building is the opportunity to tell people who we are and educate them. And we really focused on letting them know that you want to be a good professional, let me show you how. Get to know who we are and what impacts the issues that impact our life, and you're going to be great at your job. And it's kind of like it helps me to not feel like that I am begging people to see me and to see other people who are not cis and white and wealthy.
It's interesting. We just finished another poll, and it kind of endorses what you say. We asked what two factors have the strongest impact on broad public embrace of LGBTQ plus equality. And we got two dominant answers, both with 70% respondents saying, on the one hand, laws, so legal protections and regulations. On the other hand, advocacy and education, and then popular culture also played a very large role. In a sense, we need to end up bringing people together on a voluntary basis with a lot of understanding. And that does require listening, talking, advocacy, and even in Ellen, and we're gonna close out this half hour with you, Ellen. Even in your evolution at Fenway, where you're providing health to a broad array of people, bringing them together, helping to serve the community, that's part of the dialogue as well, right?
Sure. I mean, I think one thing I was just reflecting on when I was listening to Phyllis is just, being mindful that we all have our own work to do. And I think that's true for us as human beings. And I think it's true for us in our institutional settings, in our organization. So part of what we're really working to do at Fenway Health is to really build on this very proud legacy we have. It's a nearly 50-year-old organization that, came about in the early 70s through the AIDS crisis. And now here we are to remain relevant to the people that we are here to serve and to do the best work we can. We really need to show up by centering racial equity in everything that we do. We have to really understand and embrace that there are racial equity implications to every decision that we make all day long. And we need to do that in a way that invites people into conversation and doesn't push them out or make them wrong or shame them or shame us, each other. This is really critical, transformative, long-term work that we need to be doing internally to remain true to the mission that we were founded to sort of serve. And I think that is going to be the centerpiece of our work at Fenway Health. And it is just core to the whole of the story for us in the LGBTQ work that we do, in serving everyone who comes to us, not all of them, not every patient, only half of our patients actually identifies LGBTQ. But certainly these are the things we need to be doing. And I guess to do so in a way that is, invites grace and patience and, really seeking to create a culture in a sense of belonging and mutual engagement and support and alignment around shared goals, which I believe we have. When you really get down to it, even people who are maybe disagreeing about what we should do next often agree about where we want to end up. And we can find that common ground if we slow down, take the time to hear each other and listen. So that's the work I think that we'll be doing internally at Fenway Health for the foreseeable future.
Such an important point that you're all making, that race is of concern to all of us, regardless of our race. Orientation and acceptance is a concern for all of us, regardless of our orientation. Embrace, helping us all, helping our friends, helping our families, helping our communities deal with this trauma is important. And you're all making such a great contribution. It's an honor to have you on. Thank you so much for attending. Thank you all attendees for participating in the polls and for coming to visit with us. That's the Nonprofit Report. Everybody stay safe. Have a great and hopefully less traumatic day, and let's keep helping each other.